Currently, there are more than 50 million Americans enrolled in Medicare, and with baby boomers turning 65 at the rate of 10,000 each day, the number of Medicare beneficiaries is significantly increasing. For nearly 25 years, the Medicare Rights Center has been a resounding voice for millions of older and disabled Americans. And during that time, that voice has had the same goal: to reach, educate, and empower tens of millions of Medicare-eligible people so they too can get quality and affordable health care. To achieve these goals, Medicare Rights has implemented a number of important programs, such as one-on-one counseling, online and in-person educational programs, public policy initiatives, and advocating for our clients in the state capitol and Washington, D.C. But at no time in recent history has the role of the Medicare Rights Center been more crucial than it is now. And to meet this challenge head-on, Medicare Rights has successfully stepped up its outreach.
This year, the Medicare Rights Center has had a great opportunity to reach out to more than 1 million Medicare beneficiaries and help them navigate through the complex Medicare maze. And with full implementation of the Affordable Care Act in 2014, we'll be there to help people understand their new coverage options and transition to Medicare smoothly. It was because of our truly dedicated, dynamic, and knowledgeable staff and volunteers that we were able to be so successful. We spoke to more than 15,000 of our clients on our National Consumer Helpline. In fact, we've gained such a reputation as a primary source of information that thousands of doctors, attorneys, social workers, and academics turned to us last year for information so that they could help their own patients or clients. And professionals seeking to deepen their understanding about the subtleties of the Medicare program learn through our online training curriculum, Medicare Rights University. Featuring quizzes and printable handouts, MRU is designed to empower any professional to better help their patients, employees, or retirees who have Medicare questions. Additionally, we've been able to reach large numbers of people through our community outreach programs, and still others through our newsletters, our blogs, our letters to the editor, and by appearing on national and local TV. We're liked on Facebook, followed on Twitter, and watched on YouTube. And we're proud to boast about our most popular online resource called Medicare Interactive. This is where people can get their Medicare questions answered. This year, we saw a huge increase of more than 40% in the number of people who visited our site. That's a jump to more than 1 million people from 740,000. We also saw a 20% jump with our community outreach program, Seniors Out Speaking. Here we have hundreds of volunteers in numerous states who are trained in Medicare and who go into their communities to present at libraries, senior centers, and town halls. Last year, more than 50,000 people attended these gatherings. Let's take a moment to hear what one person came away with at a Medicare Minute session.
So I came directly to Medicare Rights and they helped me immediately. It was like having a friend in front of you. So easygoing, people were so nice, and the solution was fixed within a week.
You've just heard quite a bit about who we are and what we do. But now, let me show you how we put a human face on some of our efforts. For example, just this past year, we were able to put more than $6 million back into the pockets of our clients who called us for help. How? By helping them with the appeal process after Medicare rejected their benefit claims, or by enrolling those with low income in programs that subsidize their medical and prescription drug costs, allowing them to afford the care they need. In many of these cases, that could be the difference between people being able to afford to take medications as prescribed or not, or cutting their medicines in half so they would last longer.
As you've just heard, the people who turn to us for help are at the heart of everything we do. And while Medicare may be an enormous and complex healthcare program, to us at the Medicare Rights Center, Medicare is about helping one person at a time. It's about listening and advocating for their rights. But mostly, it's just about making sure that seniors and people with disabilities get the quality and affordable health care they are simply entitled to.